as all of you, I'm sure, listening, with the nature of the crisis and the way it's developing. And in my own work in recent times, I've been thinking quite a lot about some of the challenges we're facing here. And one of the things that I've been very interested in is actually in thinking about, what are some of the key things that we need to do to make sure that we get at least some basics right. And, I've written a piece on this, a blog at the Center for Global Development, and also a piece that actually wants to argue that, there's so much uncertainty here in policymaking that policymakers tend to spend all their time trying to do very complicated things, where actually they may not even do some of the basics, especially those things that will always be right. The right things that they will not regret in the future. And in a context of a lot of uncertainty, one of the things that I definitely also think we should be doing is working around social protection. Because one thing we will definitely not regret is to make sure that we try to cover some of the poorest people in countries that are worst affected by this. Because if we don't do, we will definitely have to address this in far worse contexts and economic circumstances later on. If we address some of their challenges now, we can avoid that they lose all their assets, that they lose their entire livelihoods, that they have to can't really survive and can't send their children to school once we even come out of the crisis. So we want to actually focus on a number of things that we can do now. Now, the three speakers in today's conversation have been working on a paper that actually has been trying to dig deeper into one of these possible ways of dealing with this crisis for the poorest people, and this is around social protection responses. So we will today have a conversation with the three of them, and I will introduce them in a moment. And I will want to ask you to keep your questions as much as you can until the end. But we have a chat function that is generational, or at least a Q&A function that is available. And we would like you to put these questions. If they're urgent, I will briefly try to ask them to the speakers. But main purpose will be that towards the end, we will gather these questions and then try to see whether we can get as many as we can get. If you have a really urgent question, do actually the raise hand function, as you can see on the slide we're projecting. It's actually quite helpful to make sure that you don't use this or overuse this, but we may come in and see how we can keep the conversation going. But as I said, we have three really good speakers for us. So we have Clément Imbert, he's at the University of Warwick, François Gerard from Queen Mary University, and Kate Orkin at the University of Oxford. All three of them are, if they allow me to say, young scholars that are doing fascinating work on related issues across the developing world. And I think it's really worthwhile to give a bit of attention to their papers. So rather than making them do long presentations, I'm going to ask them some questions. And in particular, let me actually start with you, Clément. One of the things in the paper you've written is that you actually choose to focus very much on social protection, on the social safety net during COVID. Why so much focus on taking that choice? Why is that what you want to focus on? While maybe there's all kinds of other things to do it. Maybe why don't you start off with this question?
Thank you, Stefan, for the introduction and the question. Thanks to all for joining, and thanks to the Mind and Behavior group for inviting us and having us on this panel. So why did we choose to focus on social protection? Well, that's because what our research is about. So we've tried during this crisis to focus on the things that we actually are somewhat specialist in, rather than venture in many other directions, as it has often been the case. So I think one important why is social safety net important in these times? It's because the public health response to COVID has really in really most countries around the world has involved severe limitations on economic activity and mobility. And of course, it's important. So that has an immediate effect on economic activity in every country in isolation. But also, as all countries take these measures, then there are ripple effects globally. And it really seemed to us, and as soon as data was available from phone surveys, it became very clear that poor households in developing countries were facing very big shocks. So, for example, in early days, so in April 15th, the NGO BRAC released these numbers from Bangladesh, who were really alarming, with income being down by 75%, consumption being down by 20 to 30%, emphasizing what we know, studying poverty in developing countries, that poor households have very little assets, have very little buffer. They often engage in income generating activity where there's there's no contract, and so whenever you can't work, well, there's no income for you. I think so that's one reason. So there's a shock, there's a big shock happening. It's also I guess a type of shock that's like no other, because it's a shock that's been decided. So it's a public health response, lockdown, then an economic shock that's imposed by the government. Of course, we don't discuss or question in any ways the responses taken by the individual government, but of course this implies that the governments have the responsibility also to help households cope with this shock that's imposed on them. I should say also that although our piece was written early on in the crisis, of course, even as lockdown is eased in different countries, the economic shocks and the effects on employment are still very much there. So here's why we decided to focus on safety nets in the wake of this crisis. And so our core argument is that that middle and low-income countries can have and can develop a very much an extensive response that will look different than the one that higher income countries have developed, and we'll be covering, and in the course of this panel we'll be going through those different parts, those three parts that we've identified. So one part of this response is a social insurance system. And that part is the one that will look a bit more like what higher income countries can use. But of course, because the labor force in developing countries is maybe 80 to 90% informal, this might have a limited bite in terms of covering the maximum number of households. So the second pillar of a safety net strategy to cope with the crisis is social assistance. And there really, developing countries have really many different programs to rely on, and in many cases, a large share of households can be covered through them, as long as they leverage all together and in different ways that we will discuss. And the third part is about a more local response, potentially the importance of non-state actors locally to identify and also assist vulnerable groups who may not be adequately captured or covered by either social insurance or social assistance.
Okay, that's really good, and I think we should take these different pillars a bit in turn. But I'm tempted to ask actually first a bit of a prior question. When I talk to policymakers in developing countries, advisors to prime ministers and presidents, said, "This is all nice what you tell us to do this, but we don't have any money." Maybe François, maybe you can tell me how to think about this challenge of resources.
Yeah, no, thanks, Stefan. Yes, so it's definitely true that governments are facing very big kind of public finance crisis at the same time as they are facing an economic and a health crisis. So it's kind of like two part of that. And on the one hand, because of the reduction of the economic activity, governments around the world and including in developing countries are seeing like large shortfalls in their tax revenue that could be used to kind of fund the social protection response. But then what's very different in kind of lower income countries and in higher income countries, that in higher income countries, government can borrow at relatively low interest rates. So you don't have you have a shortfall in tax revenue, but you can compensate by borrowing. But that's not the case in lower income countries, which have been facing like very high interest rates in the kind of the open private markets in recent months. And then when we kind of wrote our piece back in April, before the kind of the G20 and the IMF and spring meeting, there were kind of high expectation that kind of institutional lenders and the international community would develop ambitious novel solution to really help government borrow internationally and secure kind of new aid quickly. But in comparison to the scale of the current crisis, the kind of the measure that were adopted then, they've been at best kind of modest. So there were like some important measure, like the delay in the repayment of existing debt, but nothing of the sort that could really allow government to create kind of a massive social protection response. And so it's definitely the case that the current public finance crisis is limiting the scale of what government can do to a larger degree in lower income countries than in high income countries.
Yeah, it's an interesting point, because if I may add and abuse my position here a bit of chairing this, is actually, you know, one of the things though that we should definitely keep on communicating is that the rate of returns to these schemes could actually be very high at this moment. You know, this is a moment when people are not yet totally drifted into destitution, where it becomes much harder to be lifted out again. And so actually saying spending now is actually much better than actually saying, oh, let's wait until we have some more access to resources, because it will be far, far more expensive. And so it's one of these typical things where, you know, there is, of course, a credit constraint, a liquidity constraint that the governments are facing, but the marginal return to actually spending on social protection is bound to be very high, just as the marginal return to keeping kids in schools is high, and so on, at this kind of moments when it's drifted. But I still want to actually explore further, and I think it was a point that Clément made as well, is that what the responses will look like, what the schemes will look like, may well be quite different between richer and poorer countries. And it is actually helpful to expand that on this for a moment. François, could you maybe take that as well?
Yeah, so that's something that we kind of like, we start our piece with. So of course, like middle income and low income countries are very heterogeneous, but our point and of kind of like the motivation for our piece is that they kind of share features that present specific challenges and opportunities for the social protection response, and that differ from the context of high income countries. So the first point is that probably the economic consequences of the crisis will be even more severe in developing countries. And I mean, it's not, it shouldn't surprise anybody. Like if you think about the type of occupation industries that are common in low income countries, they're going to be much less compatible with working from home and social distancing. Also, like households in low income countries typically have less access to credit, they have less savings or buffer stock to kind of like smooth the income shock on their own. The way they kind of often smooth income shock through like doing casual work or migrating to better labor markets, they're just not available right now. Sometimes they rely on kind of informal insurance through their social network, but if everybody's affected at the same time, that's also not going to be a big resource for kind of insurance in the current economic crisis. And then firms also often are more liquidity constrained in developing countries than in richer countries, meaning that it's going to be even more difficult for them to kind of keep paying their workers during the crisis. So all of these kind of make the need for government intervention, the need for a social protection response, probably even more important than in richer countries. But then the kind of the type of social protection response will have to differ and did differ indeed. So the first point for that is that the the type of program that existed prior to the crisis with the goal to provide insurance against kind of job loss or earning risk, what we typically call social insurance programs. Their scope is more limited in developing countries, and that's mostly for two reasons. One is that the share of workers that are in employment categories that are kind of more easier to insure against job loss or earning risk, typically like formal workers, like registered workers. It's a much smaller share of the labor market. So in developing countries, you have many more workers who are informal employees, so working for informal firms or being unregistered in a formal firm, and many more workers who are self-employed. And self-employed also often carry the activity informally. But then, so first, many more workers are in categories that are difficult to insure, but even for formal workers, the existing kind of a social insurance program are much more limited in scope in developing countries. For example, like the share of countries that have any form of kind of unemployment insurance is much smaller in low-income countries than in high-income countries. So the existing programs aimed at social insurance will not be able to kind of support workers to the same extent in low-income countries than in high-income countries. So that's why kind of social insurance can be a tool, but it's not going to be enough. It's clearly and to a much lower extent than in high-income countries. Now that being said, there are other programs like that are more common or relatively large in many developing countries, and we have in mind this kind of social assistance program or like anti-poverty program. And so this program cover often like a large share of the population in developing countries, including in contexts where kind of informal work or self-employment are kind of the norm. This program can take various forms, and like some are kind of cash transfer, some are conditional, and some activities are not. Some are direct delivery of food. They're not aimed at insurance in general, so they typically target like low-income families, so they are targeted at anti-poverty, but they can be adapted in the current crisis to kind of have new roles that they don't typically have. And also they can provide kind of an important base for kind of emergency assistance, because they've built an infrastructure to kind of channel resources to individuals. So that's kind of a infrastructure that can be used in times of emergency. So these kind of existing social assistance programs are kind of a pretty valuable mechanism to provide emergency relief to households in these countries. And then kind of the fourth point that we motivating our piece with is that there will always be kind of some vulnerable population. Think about informal workers with like volatile income or migrant workers. They're not going to be easily covered by social insurance. They're not formal workers. They're also typically outside the population targeted by social assistance program. They're not kind of like you kind of consistently pour also in one specific place. So they're going to be particularly hard to reach in an emergency. At the same time, there are actors that are very active in developing countries at the local level. So think about local governments or non-state actors. That could be very helpful to kind of assess unmet needs and to deliver assistance. So there are opportunities to kind of involve these local actors, but there are also challenges because the action of these actors have to be kind of coordinated and monitored to kind of ensure efficiency in delivery of aid and accountability.
Right. There is a question from Elizabeth Walters from Cape Town. Can we hear it?
Elizabeth, please unmute yourself.
I'm so sorry. My hand went up accidentally. So sorry.
Okay, good. Now that's okay. We look forward to hearing from you later then. So I think moving forward a little bit is that, this is, I think, social insurance coverage and try to find ways of expanding it. So that's clearly one pillar. I actually want to just one quick follow-up question though with you, François, is to actually say, well, you know, do we have any examples of places where this is happening, or things where concreter examples on which you could build in this particular context? And so give us a flavor of what it could look like, either from the past or things potentially that could be building on to implement it in an effective way.
Yes, no, so social insurance type program are kind of aimed at kind of formal workers. So of course, like in low income countries, that's going to be a smaller share of the population, but it's important to realize that despite kind of pervasive informality, formal employees often constitute a large employment category in some countries, especially in middle income countries. And these workers may not be well equipped to face like economic shock of the sort that we see these days. So expanding aid for them can be quite important. Now, what is done and what can be done? So we discuss in the piece kind of both the type of program that can be helpful to avoid the destruction of existing jobs, and the type of program that can be helpful to kind of help provide income support to formal workers in case of layoff. And so on the kind of the first type of program, that avoid the destruction of existing jobs, we discuss at length kind of the job retention scheme. Think about the furlough scheme in the UK, basically, in which government pay part of workers' salary in the case of kind of a temporary reduction in the number of hours work, or even the suspension of a job. And so what's an advantage of these kind of schemes, that they avoid the destruction of existing jobs, which were viable prior to the crisis and could be very much viable again after the crisis. And so these schemes, some version of these schemes did exist in middle income countries like in Brazil, but they were typically, or they are typically much more common in richer countries, in Europe, for example. But they could be quite, the case to kind of like develop or build on this scheme could be quite important in developing countries. First, as I said earlier, because many countries don't have unemployment insurance, in the absence of a job retention scheme, formal workers will have less to fall back on than in richer countries. There will be no other natural program for them to fall back on. At the same time, if you don't have unemployment insurance, it might be logistically easier to create a job retention scheme than an unemployment insurance scheme, because you can use firms as an intermediary to channel the income support to their workers. You may not have to build a whole infrastructure, kind of a set of unemployment insurance agencies, etc. And then what could also be important is that in many countries, including developing countries, it can be particularly important to try to maintain existing relationship between workers and firms, including in informal sector, in which kind of growing informal sector has been kind of an important policy focus. So many firms in developing countries highlight the difficulty to find the right workers for their growth. Many workers struggle to find the right firm because they may not be able to signal their skills. And then we also found that displaced workers take much longer to return to a formal job once they are laid off than in richer countries.
Okay, very good. I think, okay, so this is social insurance, workers' insurance. Surely if we're going to trying to reach an awful lot of people, especially once we come to more and more poor places, and maybe it's a question for you, Clément, is that, you know, how would we think about expanding further now social assistance? How should we target? How can we actually do this now at the national level? And for who should it be? What kind of assistance? Can you maybe tell us a little bit more your thoughts on that?
Yeah, of course. So what's really interesting is that coming into the crisis, most developing countries really have a range of social assistance program and have really developed as part of their anti-poverty strategies many different tools in which they, in ways to support the poor when they face a negative income shock. So I think one could classify them in at least maybe three buckets. One would be cash transfer, very simply. Another might be in kind, or for example, food provision of subsidized food or free food, or other essential necessities. and another would be public works. Right? So in that order, maybe of course, cash transfers are very immediate. It's sort of something you can really use directly, and they're fungible. Like households can use them for whatever they like or whatever the way they need it. I should say in-kind transfers have proved to be very useful in times where, for example, supply chains were slow to bounce back. I'm thinking, for example, of surveys that have been done in urban areas in India, in Delhi, showing really that at a time where the supplies were not coming in, this doubling of food rations for households in India was really really important. And then public works were not exactly compatible with social distancing, but then they've been used. So Ethiopia decided to, in the initial phase, to waive the work requirements altogether. So it sort of became a cash transfer in a way. So that's a sort of landscape of social assistance. Another dimension in which those programs are very varied is that they might have very different target groups. So social pension might target the elderly. There might be child benefits for families with young children. So another thing that countries have been doing is to basically use all these different programs potentially to reach the same households more than once, right? And get to them in a different way. So our basically part of in our piece, what we try to do is to give a sense of the sort of patchwork of policy responses, of sort of safety nets that might in the end really provide some sort of solid support to households in times of need. Now, of course, one shouldn't think that the patchwork be a perfect patchwork with no holes. So, for example, there's been a very important concern that's been, for example, raised by Rima Hanna and Ben Orkin in their policy advice to the government of Indonesia, which is to say, for example, like this very important program PKR, which is a cash transfer, and there's been been increased in amounts and frequency. But their point is that in those times of crisis, you need to assist not only the poor, but perhaps also the lower middle class that's so impoverished that it now needs to be helped. And of course, that involves, and I think that's a bit what you had in your question as well, which is where that involves not only use all the programs and all, but you also need to broaden their coverage. And that's, in some contexts, that it might be easy. So to increase the reach. So some countries have done it quite efficiently. So I'm thinking, for example, of Peru. So they had done a whole census of the poor. They had the census of households to determine who was poor, to determine who should be the target of an anti-poverty program. Well, they took back this, the census back of the shelf, and they said, okay, so let's look at the people who were not deemed, eligible, not deemed that poor to, in normal times, and now let's extend assistance to them. There has been other sort of, very, I think, courageous and ambitious policy responses. For example, from Pakistan, decided to triple the number of beneficiaries from the flagship SAS programs, and to information campaign. If you're poor, if you think you need the help, well, get in touch, and we'll enroll you. I think that's maybe something you were talking, you mentioned a few times that you should social programs, investing in social programs is something you won't regret. So it's something if you do this now, it will have long-term positive effect. I think there's another way of saying a similar thing, which is to say that now countries under the pressure of this crisis, they have now started doing things, or improving and expanding their social protection in ways that will be very beneficial for the future. And so here I wanted to take the example migrants. So some of my work, I've been looking at rural urban migration, for example, in India, and a lot of this is between states. And traditionally, historically, the social protection system that India has built has been state-based. And so you needed to be registered in your village, and you could perhaps take your entitlements with you as long as you stayed in the state. And what this does is to really exclude a lot of people who are the migrants and who are migrating to urban areas and might be quite poor. And in this time of COVID, they need more help than ever. So what the Indian government is now doing is to push the idea that one nation, one ration, and to finally make those rights fully portable across India. So I think that's the type of innovation and sort of reform that maybe should have happened 20 years ago, but it's happening now, and it's a sort of a good thing, and it's a really direct response to the crisis. Yes, is Stefan still here?
Stefan has just dropped off, so if you continue, I'm sure he'll rejoin us.
Yeah, well, then it's very easy for me. I'll just hand over to Kate, because what our sort of intermediary sort of conclusion at that stage of our piece was to say, okay, social insurance, can work. There's lots that can be developed. Social assistance provides a strong basis. But even then, as you try to extend coverage and try to be as flexible, adapt, and also, adapt quickly to the needs of people locally, you really want to be relying on local actors and potentially non-government actors, and that's the third pillar of our work. So I think I'll let Kate describe it.
So just to say, for anyone who's we keep referring back to this paper. So the panel was based on a paper. I've just pasted it in the Q&A window if anyone wants to have a look at it. So that's on the Econ for Exclusive Prosperity blog. So there's a lot more examples and the sort of fleshed out arguments on there as well, if anyone wants to have a look at it. But as Clément said, the third pillar that we were thinking about was really particularly with relevance to a lot of countries that have lower levels of capacity in delivering social protection and social assistance, or countries that were really having to scale up their systems very rapidly. So, I think we're now entering the second stage of the crisis, where there was this first stage, there was lockdown, and then, we really had to try and get economic assistance out very fast. I think now we're in a second stage where we need to start to say, in many countries that response is going to have to go on for a while. But we now need to ask questions about coverage. We've thrown out this patchwork, and it's going to be pretty patchy. There are going to be some places where there are populations that are uncovered. And so the third part of the piece is looking forward a little bit. So we're thinking not necessarily so much about what countries have already done, but what they could do if they're in a situation of low capacity, but they're trying to figure out how they patch over some of the holes in the system. And so we wanted to look quite a lot at the role that state and municipal governments could play, but also private associations. So sort of self-help groups, rotating credit and loan associations. So, a variety of institutional players who might have a little bit more of a reach with populations, particularly in rural areas. So we think there are kind of three things that those sort of lower levels of government and non-state institutions can help with. The first is that in many places we're in quite a low information environment. So just getting beneficiaries to sign up for programs that they're entitled to can be quite difficult. It's not like everybody's watching the national news or everybody's on the internet and knows what's going on in very rural areas. So in other instances, governments have actually used their sort of networks of people, community health workers or others at very local level to try and get people signing up for grants. So Kenya used these savings and loan associations to try and enroll participants into a new health insurance scheme. India's been using the National Rural Livelihood Missions and the network of self-help groups to try and get people into rural sanitation programs. South Africa was using early childhood community caregivers to try and get people to enroll for child support grants. So as we try and extend the social safety net, we can use other networks of government providers to try and make sure that the hard to reach people really get into the program. The second thing is, we have to be aware that in some instances, there are people who are unbanked. So globally, only 69% of adults have any kind of digital bank or mobile money account. Only 30% have ever received wages or government transfer payments sent directly to them. So they're going to be people we can't just send money. If it's we're either having to get people to literally come and collect grants or food, or we need to think of other ways to channel support to them. And so the fact, for example, that these informal savings and loan associations have very broad coverage, something like that might be quite useful in getting money out. And then I think the final thing is these institutions may have funding or staff at a local level that could be part of broadening the social protection response. So, for example, Rwanda is currently using local structures to target their in-kind food security packages. So the very local levels of government give information on the number of households that need the food support, and then that gets relayed upwards. And that may be true in many countries. So I think we tend to think of lower capacity states. That is true. But what we really wanted to emphasize is, states do have a lot of different kinds of structures that they can draw on in broadening access to these sorts of schemes. And I'm going to, is Stefan back with us? Otherwise, I'm going to throw, oh no, there he is. Okay. Stefan, we've got you again. Oh no, he seems a bit frozen. I'm going to throw a question back to Clément then. Which was, one of the things a lot of people have asked us about is you rapidly expand these schemes, aren't there dangers of fraud and corruption? What do you think? Should we stop all worrying about this for a while? Or what position should we take on potential leakages in these schemes?
Yeah, I think it was also I was reading the question. There was a question from Alicia Mortar saying, how would you think about targeting for low-income countries where large portions of the population may need support? If you need to target financial limitations of others, which methods would you use and why? So I think this question of appropriate targeting is important. In this time of crisis, it's and as I try to describe also, I think this idea that you don't want to be too restrictive in your definition of who should be eligible for support, also because there are people who in normal times would be considered as not being poor, who are now falling into poverty because, for example, they draw their income, which they might in normal times have a relatively high income, but if it comes from informal sources and suddenly they're without a job, they would need help. So there is a sense that you really want to sort of expand and be more lax in terms of targeting. And there's a sense also that maybe you could enroll and sort of check later, but of course we shouldn't and a lot of scholarship has been devoted to and a lot of government resources are developed to plug leakages, to make sure that the money goes into the right pockets. And so this this is still important and maybe even more crucial than ever, as government also are facing those financial constraints. So so there are ways really to curtail corruption, to make sure that you identify the beneficiaries. So for example, it's not because you're enrolling people remotely, for example, that you cannot check their identities. You can have ways in which you use apps and you use ID, biometric ID. So there are ways still to maintain, if you want, the relatively high standards or the best practices usually used to reduce corruption in this time of crisis, and tries to adapt them while still keeping in mind that yes, these are exceptional circumstances, and so to the extent that the government can do it, they should they should be more generous in this time. There was another question, but maybe we can come back to the end from Myron, which was I think a very good one about the sort of how we think about the more long run aspects of the response. So Myron is saying, did Pakistan maybe scale up too soon and hence now facing budgetary constraints? In other words, the crisis appears to be a long-term one. So how should countries think about staggering their response? And I think it's a very important and important question as to how long do exceptional measures last? When do you want to start rolling them back? So here I'll take, but maybe Kate and François will have also some answers on this based on their experience and other countries as well. What I see in India, for example, is now that the lockdown is being released, the hope is that income starts flowing back, and so that no new exceptional measures will be needed. So, for example, the doubling of rations has a time limit to it of 3 months. Of course, this might be a bit optimistic, because it's not just because a country decides that now the lockdown is over that the economic growth and for example, demand for exports, etc., is coming back. The world as a whole is probably heading towards a relatively long economic crisis. So yes, so I think that's a very important question about the longer run. I don't know if Kate or François, you had some thoughts on that.
Yeah, I mean, I think.
Yeah. Okay, Kate. Sorry, I was cut out. We had a series of power cuts here. It's not a usual thing that happens during webinars. But Kate, why don't you take it? And I have a few more questions then for all of you.
Yeah, I mean, I think there were two just questions I wanted to highlight that had come up that I think were really good points. So Julia Chenier had said, if debt repayments have only been postponed but not cancelled, is expansion going to become less financially sustainable in years to come? And then Ed Davey was saying, are there political economy differences between countries that have scaled up like Pakistan and somewhere like Egypt, which hasn't? I don't think in the piece we didn't talk about this massive disparity that's arising between countries that had been relatively fiscally prudent or have more access to sort of dollar swap lines, who are really able to expand social protection quite a lot. And then there are other countries that are in a really bad debt position. And then there's also political economy considerations and which countries actually care about their poorest populations and not. So I think as we look to the long-term sort of issues coming out of this crisis and in terms of poverty, it's a really challenging area to think about for aid donors and others, because countries are very different in their way, in the extent to which they've been able to respond to this locally. And so there's going to be very big disparities in the levels of poverty coming out of the crisis, just because of the country's macroeconomic position and their political economy. And so we may have countries that were very similar income levels before, where now there's really big disparities arising. We don't say anything about that in the piece, but I think it's really important to note.
So I want to invite anyone in the audience that also wants to speak and make a comment and ask questions very briefly, to actually just use the raising hand function now, so we can come to hear some other voices. But let me ask each of you a question, and you don't have to answer it if it's not obvious for you. But of all the different, you've mentioned a whole series of examples of what countries have done and not done. And of course, we're all concerned about longer term sustainability and how we'll do it. And of course, one of the things that is going to be crucial is that, given this enormous uncertainty, U-turns may be needed and people may need to change or whatever. But I just want to ask you, is there any country in terms of its response to social protection that you think other countries could learn from, that you've been impressed by in recent times? And just point to, even, it's probably not the entire program, but something that actually is really, where are we beginning to see the lessons? And you're also free to mention something where you say they should have done something and they definitely should have not made certain choices in around social protection. So any suggestions here?
François, do you want to start?
I mean, I think so we wrote this piece in early April. We finished this piece in early April, but we started before that. I think one thing that struck us at the time was that a lot of kind of middle income and low income countries were very early adopter of social protection response, and were quite creative in their policy mix. So Clément mentioned like Peru, for example, that has been kind of early on was kind of mentioned as kind of an example of a country where they seem to be trying to do everything right at the kind of higher level. Now we've seen in more recent days that didn't prevent like a catastrophic kind of public health consequences. But I think in terms of like early on, the kind of the social protection, they were quite good at kind of trying to create the type of policies that we kind of describe in the piece. But then we also discovered in that case that kind of implementation details can matter a lot. So for example, the kind of the emergency transfer that they created that was aimed at reaching like millions of households in an emergency in Peru. As Kate mentioned, many households in around the world don't have kind of are not bank, don't have a bank account that you can easily transfer the money to. So then people had to kind of essentially line up to ask for the transfer, and that has created a lot of bottleneck, a lot of kind of reduction in social distancing, a lot of delay in people receiving. So I think often in this kind of policy mix, the kind of the implementation detail on the ground end up being extremely important, and then that's where like administrative capacity at all level of government really become first order.
Right. Any others?
I was going to say, I mean, not to pick out a particular country, but I think the World Bank, so Ugo Gentilini has been tracking all of these different countries' social protection responses. And my overriding impression, obviously there are many ways in which the response could have been done better. There've been a lot of challenges, but it has been remarkable to me how many countries have managed to move pretty fast and get pretty large payments out the door with a fairly, what we might think of as fairly low state capacity. So I think it's been really encouraging for a lot of donors and governments that have invested in social protection infrastructures to see how they can be used in a time of shock and crisis. And things have been very bad, but they we mustn't also lose sight of the fact that they could have been worse without the cushioning of those social protection infrastructures. And those are new things. They've only been there in the last 30 years. So I think, across the world, there've been a lot of really encouraging examples, which was part of why we wanted to write the piece, to say this, just to showcase some of how that investment in those infrastructures had paid off in many countries.
Yes, I actually wanted to tie this with a question from Enrico Pizzardi saying, be curious to know about any specific creative solutions you've seen from particular countries that focus on using digital payment infrastructure during this response. In that case, what can we learn about these cases? I think a lot of the push that has happened in the last decades about, and it's a push, it's not describing it as a, it's not necessarily a government action, it's also, just the, banks like mobile banking expanding. So in many different ways, financial inclusion has progressed in developing countries, and in situations in contexts where the banking system, like the physical bank branches, are nowhere in sight, and so that has really enabled a fast response. For example, Chile or India has this as well, where the government created zero balance accounts, so just to bank the poor, and that was like it was just a click. A click, and of course a lot of financial resources to send to those households, money to those households. So so I think that has happened around the world. And I think in terms of best cases or poster child, it's every country or every government is struggling. What I've been very impressed by is basically the sort of the political will I've seen, for example, in the state of Bihar in India, which is a very state known for for having a lot of poor, a lot of sending out a lot of migrants throughout India. It's also a state that's known to have a relatively low state capacity. And so they've done two things that I found very remarkable. One was to use SAG members, most often female, go out in the villages to update the poverty register during the crisis. So can imagine the type of bravery and courage that implied from this woman. So that's one example. And another thing they did is that they decided, that was very unheard of, to take charge of their migrants. So they said, okay, we now want all the migrants from our state, from Bihar, to register online, download an app, and they'll get 1,000 rupees. So of course, again, how many of those migrants actually heard about it, downloaded the app, and whether 1,000 rupees is enough to get by more than a couple of weeks. It's another question, but I think I've basically, where in the context I know best, I've seen really a remarkable sort of political will.
Right.
It's also, if I can just add, sorry.
Okay. Why don't you ask?
I just wanted to add a small point. So all of these is just to reiterate, that's in a context where developing countries don't have that much funding space, right? So it's in a context where maybe, it may make sense that kind of richer countries will focus on their own situation. And in March, in early April, when things were really, really bad in Europe, the US, but as things are easing a little bit in richer countries, it's probably but things are not necessarily getting much better in developing countries, and it seems that it's going to last quite a bit of time. Maybe now is a kind of a good time to really kind of restart a discussion about like the kind of novel solution that could be created to kind of create more space for developing countries to kind of pursue some of their social protection response, because it seems that in some countries we're still not at the peak of the public health crisis.
Kate, you wanted to come in?
So Jonathan Sturio from the OECD had this question: how do we see the role of public works programs? There has been little application so far. One of the things that was interesting to us, actually, I think both, Ethiopia, for example, had always been very strict on having a public works requirement for welfare programs, and they actually waived that in the process of the crisis. So this is super interesting, because there's been a lot of debate about whether it actually makes sense to run public works programs or we should be moving over to cash grants. So I think it is going to be, that's some concrete example of the public works list could be used as a list of beneficiaries to channel income assistance, which was great. But I think in the long term, it may also raise some debates about, do you actually need the workfare requirements, or can you just go with a welfare system?
I can add to that on the Indian side, there's no discussion, no public discussion of waiving anything in the requirement. But the migrants are back home. This is currently the lean season, and before so before the agricultural season kicks in a month, basically, we've seen public works definitely being used in rural areas, and the plan is to ramp them up further. Oh, sure.
Yeah, and so I want to add, actually, as an example, in conversations with Minister of Finance in Myanmar, where they're consciously thinking about using workfare programs during the early parts of the recovery. So the social distance and so on makes it all a bit harder for them to think about these programs in a sensible way, and public health advisors are advising against it for obvious reasons. But it actually there's another impetus now for introducing that there, something that was politically never possible. And I want to actually, this more general point is that both whether it's on the digital inclusion and the technology side, or even on the social protection, in my experience over many years, there's several countries where the political economy always was that they don't like it. They don't like the idea of giving transfers to people, nor do they think, oh, this digital stuff, that's for young people only. You know, the fact that we are sitting here using a technology that existed for 10 years, but we never used it to do seminars like this, it's exactly the same what's happening with a lot of people that are not anymore, very young people just playing on their phones. We're getting ministers, leaders in governments having to use Zoom for all their interactions, suddenly discovering, hey, actually this thing works. And actually the interest in all these digital solutions, similarly for developing countries, is actually rising dramatically. The same with social protection, that actually it is not creating these terrible consequences and this laziness of people. Most people are desperately keen to go back to work. They don't really want these transfers. And it may well actually have a really positive impact on some political economy things there. And I think, you know, for all these people saying, how can we make it help to stick, is actually making sure that we keep on learning these lessons in terms of what we're doing. I'm doing a quick check on the clock, and we have 1 minute left. I just want to invite, if any of you want to have a closing comment, 20 seconds, maybe something there, say, this is the question I would like to see answered, and I would like to know in 3-4 months from now around social protection programs. What would it be? What would you now want to know in 3-4 months that you don't know now about the responses around social protection? Who wants to start?
I can say, so one thing that I'll be very curious once things calm down and we can just start doing like actual research, like detailed research on this, is to which extent the social protection response was a complement to the public health response, to which extent by transferring income to households, it allowed or it facilitates them staying home or avoiding kind of spreading the disease or getting the disease. I think that's that the degree to which that happened, I think it's something that I would be very interested in learning in more details down the road.
I think long-term human capital impacts, you know, it's the argument we make for this, is we want to stop children, you know, having poor nutrition, being stunted, losing long-term growth. And just to know, did that actually play out? I really hope so, because that's a lot of why so many people have invested in these systems.
Okay, Clément?
Yeah, so that's I guess one thing I've been interested in is the way social protection in India has been moving to facilitate, you know, to be more accommodating to labor mobility, to migrants, and whether that will really, you know, be sustained in the future. So I'm definitely interested in that. And also, you know, as many migrants went back by fear of the COVID, a lot of the destination states, you know, states that actually need that migrant labor now are taking all these steps to try and retain them or get them back. And that's a new sort of state of affair in the labor market. So I'd be interested to see whether there's any long-term effect of that.
Well, thank you, Clément, and thank you to the three speakers. I mean, what I take away from this is, you know, of course, there's lots of questions that we don't know what to answer, but I'm actually come away from all this quite positively. I think when you were writing the paper, you were probably trying to hope countries would start doing certain things, and you started certain bits and pieces that are going to take place. I mean, it is the case that an awful lot of countries have actually tried to respond with various ways of doing social protections in ways that is unprecedented. And even in poorer countries that are resource constrained, they have seemed to be doing this. So, you know, in all the doom and gloom that we have around what's happening with COVID and what's happening in developing countries and the consequences, and yes, we do keep on seeing the monitoring service coming out, and actually the situation for many very poor people is very dire, there is actually something positive, that it probably could have been far worse, and that actually the way public policy has been responding in recent times is maybe much better than probably people like me and maybe like you would have thought, you know, 4 or 5 months ago would have been possible before the crisis. So I think, of course, we will have to see, and later on we will see some of these longer term consequences and the changes that will have been brought. We'll need to close this. Let me just finish by saying that everybody that has dialed in will be getting the link to the paper. We will email it, we will forward it to you. Also tomorrow this conversation will be on YouTube, and I will be for part of it there, and the other part I'll be fixing a power cut. But otherwise, I would just thank you for all of you who have stayed and listened to us. And if there's further questions, do contact the speakers, do contact CSAE, do contact the Mind and Behavior Research Group. We'll be very interested to continuing the conversation. And thank you to the speakers, and thank you for all of you to listening for this very interesting seminar. Thank you very much. All right.